Hello, everybody. Welcome back to Pep Talk. Um, so, if anybody out there is a big Mevo camera expert, I would really appreciate your help because we're having issues with getting our big production camera, if you will, all set up. So back to you from my laptop again this week. But real quick, sorry for the delay of getting started, but I'm Dr. Carrie Moore. We're going to be diving into some really exciting topics this week. So we're going to be talking about um, some of the adjuncts to the GLPs, like um, AOD904. We'll be talking about phentermine. We'll be talking about a lot of these things. So, we're going to dive into that first and foremost before we even get into the peptides and talk about those. I wanted to cover some stuff that I keep getting a ton of questions this week, not about peptides. So, wanted to cover for you guys a little bit. One thing, I already put out a PSA earlier this week, just a quick reminder for your kiddos. The Neatos, which are these little toys or little squishy toys that your kids are using, they love them. They think they're satisfying. They're all um, squishy and they stretch them. Well, so they're putting those in the microwave and essentially they're blowing up and they are getting all over the kid's skin and they're burning them. So we're seeing a ton of that, getting pictures from patients, getting patients coming in, seeing them in the emergency room, and they are causing some significant damage. So please make sure you remind your kids, do not use the microwave with their Nito. Don't microwave it. It's going to blow up. It's going to get hot. It's dangerous. So, PSA on that for all the moms out there dealing with Maycember. And anyway, so just on that. And the next thing I keep getting questions about that are not peptide related is the hantavirus. Everybody's wanting to know, can I fly? Are we going to be into the next pandemic? Is this going to be an issue? Okay, folks, let me tell you something. Hantavirus is not the same as COVID-19. It's not the same kind of virus. It's not spread the same. Hantavirus is has been endemic, meaning it's lived inside the United States for a very long time. It's endemic to the four corners of the United States. So it's been there. We've heard about Gene Hackman and his wife passed away. They were in the four corners where this disease is living. And, yes, the common story on a board exam for hantavirus, right, is, somebody was cleaning out their shed in the four corners of the United States and got in touch with some rat poop and they got hantavirus. I've seen hantavirus. I have helped take care of hantavirus back in residency. It's been close to 20 years, 17 years or so, but I've seen it. It's a terrible disease, causes horrible bleeding in lungs, just hemorrhagic pulmonary edema. It's a nasty bug. Yes. So definitely not something you want to pick up and scary and all. But here's the thing. Yes, the Andes strain that was picked up that's been on this cruise ship is a variant that can be spread from person to person, right? However, like this was a specific group of people, again, who came in contact with an area that was endemic to that virus. And so this is not like something that doesn't happen annually. It just is getting a lot of attention because there is a cruise ship, right? And, it's after the COVID pandemic, obviously everybody's super scared that like something's going to turn into something, right? But there's really no reason for the hantavirus to be a generalized public threat. So if you're wondering, like, why isn't the White House or you know, um, why isn't the governor out and talking about the hantavirus? Well, because guys, like it should be fairly well contained. We know who these people are that were exposed to it. There should be no threat to the general public. Okay. I've joked with friends and colleagues that like if hantavirus becomes a thing, I'm totally retiring because that's that's it. But in all seriousness, you should be totally safe. You should not be freaking out. I have no idea where the mainstream media is making such a huge deal out of this. I mean, yes, it's terrible that it's on this cruise ship and that these people were affected, and it does have a very high mortality rate. But again, this is not a new virus that we don't know about. This is not a new created bug in a lab somewhere. At least I hope not. Um, and so don't worry. You don't need to be sitting there worried about it. Instead, how about we think about happier things like getting fit and well? And let's dive into our pep talk. But if you do have questions, by the way, if you're scared, you're concerned about hantavirus or the needles exploding on your kids, please feel free, give me a buzz or, shoot me a message, and happy to address those things. But again, not worried, not altering my plans, not planning on being forced to be locked down or anything like that with the upcoming, with any kind of upcoming pandemic or anything like that. Um, so let's get into it. Let's talk about some of these other peptides and other medications for um, use mainly with the GLPs. The GLPs that we're talking about that people are using are Ozempic, Wegovy, Mounjaro, Zepbound, maybe even retatrutide in the future. We've got now the Foundayo, which is new oral variant from Eli Lilly, which is another GLP type medication that's an oral med that just came out as available. So, not talking really about those today. Yes, those are the great mainstay of what is going on with peptides, if you will, treating obesity management and weight management long term, as well as diabetes management. But today, we're going to really talk about the other side of that conversation. So, I want to talk to you a little bit about the adjuncts, the peptide add ons, if you will, the metabolic enhancers, the fat loss amplifiers, the compounds people are stacking alongside traditional weight loss programs. So, when people talk about stacking things, they mean adding different um, peptides together, right? Different medications and using those in a stack. Kind of makes me think of the old school way guys would talk from the gym, like that were stacking testosterone. But at any rate, so we're going to talk about MOTS-C, AOD904, tesamorelin, CJC 1295, phentermine, topiramate, L-carnitine, and some peptide combinations, muscle preservation, and mitochondrial optimization. And where all this is heading right now. Because right now, the biggest shift in metabolic medicine is not actually appetite suppression. It's actually optimization. So we're optimizing our metabolism. So, why, if you've got your GLP that's working for you, why are there people out there looking for adjuncts to use with this if those work so great? Well, they do work great, but so why are patients suddenly really interested in these secondary compounds? Well, many people are realizing a couple important things. Losing weight and then optimizing body composition are not always the same thing, right? So a lot of people can lose weight, but they don't necessarily feel stronger. They don't necessarily look healthier. Their energy isn't necessarily improved. They may not be preserving their muscle, which is a huge, huge one, um, or improving their metabolic performance. So, a lot of concern, right, with the GLP use is, man, I'm getting skinny, but my muscle tone isn't great. I'm not building that healthy weight that I want to continue on. So, honestly, one of the biggest concerns in aggressive weight loss right now is how do you preserve lean mass and ensure that we're not losing the right kind of weight. We're losing that fat weight, right? People are becoming smaller with this weight loss with Wegovy and Ozempic, right? People talk about the Wegovy Ozempic face, and but they're not necessarily healthier. So, and I would say that yes, if you are on a GLP, long-term studies are showing, long-term improvement in your cardiovascular risk, right? Less chances of heart attack, stroke, and all those things that, your cardiovascular health do improve just by the weight loss. That's 100% true. But overall, you may not be optimized in your total health if you're not um, if you're only relying upon using a GLP. So, now doctors and patients, I think right now are asking, how do we preserve muscle? That's the number one thing. How do we improve our fat metabolism and how do we improve mitochondrial function? I was little mitochondria, little beans. You remember when you're in science class, you had to make a cell and you had to make a little bean was mitochondria. So we're thinking about those function of those little beans in our body. How do we optimize recovery and energy while we're losing weight? How do I not feel terrible while I am trying to lose weight? And that's where some of these adjunct therapies will come in. And some of them are good to use in combination, some of them not. Um, so when talking about MOTS-C, the mitochondrial peptide. So first of all, when we talk about MOTS-C, and this one is not currently FDA approved, but what's cool about this one is that it is on the list. RFK put it on the list in April to whatever you think about RFK, it doesn't really matter, but he has put this over from it's one of about 12 peptides that have been moved from a category 2 restriction to they're moving it over to be reviewed by the compound board people. So that by July, this should be able to be safely compounded and able to be used by compounding pharmacies. MOTS-C is one of those. So the goal in removing those level 2 restrictions on using some of these peptides is that you will stop getting them from the black market, gray market area where it's kind of like, where are you getting it from? And get it to real regulated and safe compounding pharmacies that, you're getting the actual medication. So I'm pretty excited about that. I think MOTS-C has a lot of potential of being a really great peptide for use. So I have seen a lot of like influencers online trying to push the MOTS-C, and I think that's fine, but I think you got to be careful about especially listening to them on dosing and expectations and understand some of the risks affiliated with it and side effects and make sure that you have a physician overseeing that. It's not necessarily bad, but I'm not going to necessarily, again, and I say this every week, not going to get my advice from, you know, Bobby, the influencer man who is just, doing this to make money, doesn't really have any knowledge base of it. Um, so the MOTS-C, it's really fascinating. It is a metabolic kind of functioning medication. So, meaning your mitochondria, which are your cellular energy factories, naturally produce MOTS-C. Okay, so all of these peptides, most of them are naturally produced within our body. This one is produced by our mitochondria, and it is heavily involved in our metabolic regulation and in our insulin sensitivity, exercise signaling, our how we use our glucose, um, and energy production pathways as well. So that's why sometimes people will call it an exercise mimetic. So it's almost like when you use MOTS-C, it's almost kind of showing your body, tricking into like signaling to your muscles that you're exercising. It's improving that by signaling to your muscles. And again, it is not replacing exercise. Exercise is still very important, but nothing replaces exercise. But MOTS-C appears that it can activate some of the same cellular pathways that are associated with exercise adaptation. So, and this is where it really kind of gets interesting. So, in animal models, MOTS-C actually helped improve insulin sensitivity, it reduced obesity, improved endurance, and improved metabolic flexibility. Now, human data is very, very early, but clinically, for people who are using it, um, many people are reporting better workout recovery, improved energy, less fatigue, improved exercise tolerance, and sometimes easier fat loss. So, what I will say, I do know of some patients that have taken it from the gray market, that they've been on this or they've gotten other places. And we actually do have a compounding pharmacy in North Texas that I'm aware of that is already compounding this, and they're regulated by the state of Texas. So, could potentially get a safer version, but I'm not seeing the huge fat loss with this that some people are promoting, but again, it's early in human studies and not a huge widespread usage of it. So it's going to be very interesting as this becomes more readily available legally and regulated into later this summer, especially around mid July, 23rd, 24th. We should be taking a look at having this very widely available with compound pharmacies. Um, what I personally find exciting is like this mitochondrial angle about it because obesity is not just a calorie problem. I think like a lot of people who struggle with weight their whole life, they're like, it's not, I'm not eating that much. It's not a problem with the fact that, I'm eating more than the person next to me. But it's more of a energy regulation problem and a metabolic issue. So mitochondria are just completely central to energy regulation. And I think over the next decade, probably mitochondrial medicine is going to absolutely explode. So we'll be watching that. Some of the things, though, with MOTS-C, you need to be real aware of. So with it, because it does target components that are signaling in our muscles, right? So it sends a signal to your muscle to improve your glucose metabolism, um, to cause like mimicking that exercise. It can cause some people will report having fever or feeling feverish. They will feel um, like their heart is racing, and a lot of that is because it's pumping things up. So it does impact that the way your body's reacting. So you're heating things up. So think about when you exercise, how you sweat, you feel hot, your heart rate gets up. So you can expect some of those same things with the MOTS-C. So another important reason you don't want to be doing this on your own and want to make sure that you are safely dosing and with a provider. So AOD 9604. This one is pretty cool. It's targeting fat metabolism. So was looking in a little bit more of this one. So the cool thing, it's really not highly available. A little bit harder to find. And it is available. You can get it with some compounding pharmacies. And this one was actually, I was talking earlier about the level 2 restrictions on um, some of these peptides. And the um, AOD 9604 was actually removed. They made the switch to try to remove that off the level 2 restrictions last year. And so it should be available. It's already gone through those compounding review, should be able to get it in a compounded variant. Now, it's still not FDA approved. Doesn't mean it's FDA approved for weight loss or proven at this point. However, it does mean that it can be legally obtained and utilized for treatment. So, um, but I hear a lot about AOD 9604, not quite as much as I've been hearing about MOTS-C lately. I don't know why. Um, Honestly, the influencers haven't really jumped on as much, in my opinion, as this one. But um, this one, like it does find some hype online. So what AOD 9604 is it's a modified fragment of growth hormone. So I think it's got like 19 amino acid chains, and um, it does not behave, however, like full growth hormone. It doesn't. So it's you don't have the nasty side effects that it was specifically designed actually to target fat metabolism pathways without the broader anabolic or growth effects associated with growth hormone itself. So usually like side effect wise, there's really nothing that's been reported except for maybe injection site reaction. So mechanically, AOD appears to like stimulate lipolysis, so fat breakdown. So it kind of gets at those cells and helps you to break your fat down, and while reducing at the same time reducing the lipogenesis, meaning less fat cells made. Um, and so reduces or increases your fat breakdown, and it decreases new fat formation. So that's pretty exciting, right? And so that's why many people use it as a stubborn fat kind of adjunct, a cutting phase peptide, and a part of body recomposition protocol. So it's not dramatic. So here's the truth. It really, it's AOD 9604 is not going to be the inject this, you're going to lose 30 pounds. It's not. However, That's just not reality. But however, um, cumulative potentially with the use of a tirzepatide or a semaglutide and things like that. So, where I think the AOD potentially is going to shine is consistency, potentially body composition refinement, especially for like bodybuilders and things like that. Abdominal fat targeting, get the stubborn areas. And then again, if you stack it with exercise, nutrition optimization, and then if you're using a GLP, definitely a exciting adjunct that should be available. And again, without a lot of side effects. So I think that's probably one of the more exciting peptides that are out on the market. And again, have already gone through that removal off the level 2 restrictions. So keep your eye on that. Interested in adding that, talk to your physician, talk to me about it. A lot of people also really like the AOD 9604 because it generally does not seem to create the same insulin resistance concerns associated with full growth hormone. It doesn't increase your IGF. So, but again, expectations really matter with this one. This is not going to be your magic drug. It's going to be an adjunct, not magic. So moving on, CJC 1295 and ipamorelin. We've talked a little bit about ipamorelin, tesamorelin previously. Now we enter the growth hormone secretolog world of CJC 1295, ipamorelin, commonly paired together because they help stimulate your own natural growth hormone release in your body. So they're not actually straight human growth hormone. You're not administering human growth hormone, but these compounds work more upstream through pituitary signaling pathways. And people use these a lot for recovery, sleep quality, body composition, muscle preservation, fat loss support, and performance recovery. And honestly, one of the most common things people report is better sleep. And in this one, as well as like Somorelin, people really feel they usually do this ones at night, do feel that their rest is improved. And that also goes along with your natural growth hormone release timelines that usually happen more in the nighttime period when you're sleeping. Sleep matters enormously, by the way, in your fat loss journey. So, poor sleep, if you're not sleeping a lot, not resting a lot, and say you're an ER doctor, you have poor sleep, your cortisol increases, your insulin resistance increases, hunger hormones going wacky, you're more inflamed when you're not sleeping well, and you have more cravings. So sometimes improving sleep quality alone can substantially improve your metabolic outcomes. See that a lot with people who have severe sleep apnea, which is kind of this horrible cycle, right? That like when they are able to breathe better, sleep better, and are not waking up constantly, their weight loss actually improves pretty drastically. Now, can CJC and ipamorelin help your body composition? Potentially, yes. Potentially, yes. Especially if you combine it with resistance training, high protein intake, recovery optimization, and proper nutrition. But again, these things aren't miracle drugs, right? The biggest mistake people make is expecting the peptides to replace your disciplines, and they're not going to. But again, like these, they do increase some ability with recovery and have the potential to increase your own human growth hormone release in your body, which will do some of these things. Tesamorelin, we've talked about this as well recently. Tesamorelin and visceral fat. Tesamorelin is extremely interesting because it is FDA approved, but it's FDA approved for HIV-associated lipodystrophy and visceral fat reduction. So visceral fat is actually the dangerous internal abdominal fat surrounding your organs. So it's not the stuff that you see on the outside. It's what is going on the inside surrounding your liver, surrounding everything inside your viscera, which is your internal organs on the inside. So it's not just cosmetic fat that tesamorelin is targeting. It's visceral fats associated, honestly, with cardiovascular disease, diabetes, inflammation, metabolic syndrome, just overall mortality risk. So tesamorelin particularly appears to be effective at reducing visceral adipose tissue. So now outside of HIV medicine, clinicians have been interested in whether tesamorelin may help with broader metabolic populations with abdominal adiposity and visceral fat accumulation. So this is still a really evolving area, but I think probably a very interesting area with, again, FDA approval for certain uses that make it one of the ones that I think is probably at the forefront here. It is pretty still expensive if you're looking about doing what the cost that you can get, lawfully and not necessarily on the gray market from a compounding pharmacy. It is can come by prescription now. It tends to run a little bit more pricey, closer towards what you would see with some of the GLPs. But from a body composition standpoint, tesamorelin has become one of the most respected peptides in the metabolic optimization world. So now let's talk about phentermine for a minute. I get a lot of requests for phentermine. It's the old school appetite suppressant. So, and one of the oldest tools in obesity management. And honestly, it still works. Phentermine is basically a stimulant appetite suppressant. It increases your norepinephrine signaling and it helps reduce hunger and food intake. It's cheap, it's effective, and for some patients, it works extremely well, but there are trade offs. There are trade offs with the phentermine. Potential side effects, include increased heart rate, anxiety, insomnia, elevated blood pressure, irritability, overstimulation, and especially palpitations. So, and a lot of if taking it at the wrong time of day, not a lot, it can impact your sleep pretty significantly. Remember, we talked about we need to have good sleep for weight loss. But phentermine does work. I mean, it will help you not be hungry. But I think patient selection really matters a lot, like enormously with use of phentermine. This is not a medication I love for use with highly anxious people. If they're already struggling with overstimulation or they're already struggling with poor sleep, phentermine's probably not the medicine for you. And honestly, this is one of the ones I tell people when they're going to start their GLP journey is that GLPs are so much different than phentermine, is that we do not have these same kinds of responses physiologically. But the right patient with the right patient, it could be used could be a very useful tool. So, especially if it's like a short term usage, trying to break a plateau, like you're just stuck and you need to get over that hump. Phentermine could be a very, good option for you. But there's combination approaches. If some folks using it alongside with a GLP, just to get past that little bump where they're like, "Ah, I've lost weight, but I'm stuck. And also I don't have a lot of energy and I'm having problems kind of, keeping myself going." So it is an option. It is an option. Not my favorite option, just based on the side effects, but it is a tried and true effective medication that is FDA approved and on the market. So topiramate is also a surprising fat loss tool that's on the market and is FDA approved. People don't necessarily think about it being that way. It's an anti-seizure medicine, and clinicians actually discovered that it caused appetite suppression and thus weight loss, because topiramate can reduce cravings and decrease binge tendencies, and some it blunts your appetite. So now side effects are the issue mainly with the topiramate. I'm really not a huge fan, to be honest with you. This one, just based on the side effects I've heard mainly from our patients. Some people experience brain fog, difficulty word finding, tingling sensations, fatigue, or cognitive slowing. I mean, that sounds pretty miserable to me. So that's not exactly the improved metabolic and lively function I'm trying to gain when I'm trying to think about my weight loss and metabolic journey. So some people really hate how they feel on the topiramate. But others, they do fantastic on it and they like it. But this is a very highly individualized medicine, and one I honestly try to steer our patients away from because of those complaints that I've heard from patients just not feeling great on it. Um, then we talk about our MIC injections and L-carnitine and some metabolic support. So, um, for a long time before GLPs. Oh, my light went off in my room. Before the GLPs became a big thing. The skinny shots, everyone's skinny shot, and come in, I'm going to do a skinny. Yeah, so that's what these, when you hear about people selling the skinny shot, it's hard to know now if they're talking about the GLP shots or if they're talking about these MIC injections. So, MIC injections are, or MIC injections is what I'm saying, lipotropic compounds. And then there's L-carnitine. So, MIC stands for methionine, inositol, and choline. Okay. And these are compounds involved in fat metabolism and liver function. You can do these at home. You can do these in office. We do offer them at Driven Healthcare. Now, are these going to be dramatic weight loss therapies? No, absolutely not. They're not. But what we do see is in many patients is improved energy, improved workout tolerance, and less fatigue, and then also better adherence to their nutrition plan. So that's one of the benefits of using the MIC injections. The other one is L-carnitine. It's very interesting because L-carnitine is a naturally occurring substance, vitamin that is helps transport fatty acids into mitochondria. Remember, we talked about the mitochondria with the MOTS-C for energy production. So, when we're looking at that, MOTS-C and L-carnitine combinations could be very useful for use together. So, again, back at that. Back at those mitochondria. So, the future of metabolic medicine may be less about starving the body and more about improving energy utilization, right? So I think the biggest mistake people make when they're talking about peptides and they're thinking about this, they think peptides are going to replace their fundamentals. And I tell you, they don't. You cannot out peptide poor sleep, alcohol excess, ultra processed food, chronic stress, inactivity, and muscle loss, right? Like you can't take enough peptides to overcome the bad habits, the bad sleep, drinking too much, right? Now, the nice thing about the GLPs and some of these is that most people, when they're on them, do not feel like drinking in excess. They actually feel like they cut down on their alcohol intake. They make better choices. Their cravings for processed food decreases pretty significantly. But still got to get active, still got to be exercising and ensuring that you're continuing to make sure your muscle tone is good. But honestly, the people who get the best results are people usually the ones that are already doing the basics, and peptides amplify that effort. So if you're one of those people who like, I can't lose weight, I'm doing everything I can possibly do. I'm working out, I'm eating healthy, I'm doing the things you're telling me to do. And I understand that because I'm in the same boat, had a trainer, try to be healthy, try to be fit, get to the gym, but without adjuncts to help in the assistance of some peptides, it's just very difficult to overcome your genetics and how your body's working together. So the people who are going to get these best really long-term good results are going to be the ones doing those basics very well, sleeping well, exercising well, and ensuring that they're eating a balanced diet, eating a appropriate amount of calories and less refined foods. So, but again, peptides amplify your effort. They do not replace it. Um, so I think the future of body composition medicine is moving towards a very precision metabolic medicine. Okay. It's going to be very precise, looking at how your body metabolizes, mitochondrial optimization. We keep talking about those little beans are in our cells, the mitochondria, and muscle preservation and fat loss. And then hormone optimization as well. And we are going to dive into hormones. My plan is next week to dive into our HRT therapy and talk about how that works in combination with the peptides. But we'll be talking about estradiols, progesterone, testosterone, how that works specifically for women, especially our perimenopausal, menopausal women, and our aging male population. And then we'll continue to be talking about metabolic monitoring and individual peptide stacking. So I think, probably eventually when you're coming into the office, we're not gonna be asking so much like, how much weight did you lose this month, right? We're gonna be looking at how much visceral fat did you lose? How did your insulin sensitivity improve? Did your inflammation improve? Did energy improve? Did your sleep improve? Did your muscle mass improve? And is your quality of life improved? Because that's the most important. Ultimately, the goal is not just be thinner. The goal is becoming healthier, stronger, more energetic, and metabolically resilient. So, before we head out today, just did want to recap on especially the MOTS-C and the AOD904. Is the great news on these is that they are again becoming more available thanks to the movement from the FDA to off of the level 2 restrictions. So you should be able to get these compounds safely from a licensed compound pharmacy, and know you're actually getting what you are hoping for with the MOTS-C. And if you have other further questions about it, please feel free to um, give us a buzz, give me a message on Instagram, Facebook, and let us know what else you want to be talking about. Do you want to let you know about some adjuncts we do have here at the clinic available for purchase as well to help you with your journey? So we do offer peptide Vite. That's available here at the clinic. It is a specially formulated medication, or not really medication, vitamin that you can take in adjunct to your GLP. It helps really support ensuring that you have the correct vitamins on board. When you start a GLP, most people are not eating as much. It's not supposed to be. I keep saying this, not supposed to be prescribed anorexia, folks. It is supposed to be, something that's helping you lose weight, but we need to make sure that we are getting a correct vitamin support with that. And this peptide Vite was formulated by some pharmacists and some physicians that has some things like vitamin B6, folate, B12, magnesium, thiamine, and some coenzyme Q10 as well. So that's available. Also available to order that for you directly from one of our compounding pharmacies that we work with. We also have these are new that we have available. I'm actually going to try this out today, but it's like you can put it in your water. It's just Immunity Go. There you go. Well, let's see if I get in front of the camera. Immunity Go. It's just a vitamin drink mix. That similar stuff to help support if you're on a peptide. So you just, make sure you're getting the appropriate amount of vitamins. This one has a lot of vitamin D, calcium, and vitamin C support, and as well as zinc. We love zinc for keeping ourselves healthy. So if you're interested in those, they're not super cheap, but you get about 30 sticks in a bag. So we have those available, I think, in strawberry and orange, and there's maybe a fruit punch or something like that. The next pep talk will be next week. We're going to again be talking about all those pesky hormones, perimenopause, especially I hope my perimenopause sisters will join in, and we'll talk about HRT in combination with the peptide therapy that's available for you to help you improve and feel your best. Thank you for joining me on this episode of Pep Talk. If you enjoyed this episode, please share it with someone and they're trying to navigate their world of peptides and metabolic optimization. And remember, the future of medicine is not just weight loss, it's metabolic performance. I'm Dr. Carrie Demore, and I'll see you again next time on Pep Talk.